everyone, and thank you for joining us for this introduction on safer sleep. I'm Lara, our Senior Early Years Manager, and I'm joined by Rebecca, who is our baby room leader and third in charge of our Amblecote branch. Today, we're going to be having a look at a bit of an insight into safer sleep and hopefully broaden your knowledge and help you with some top tips and tricks around safer sleep. We're going to be looking at what is SIDS, some facts about safe sleep, how we promote safe sleep at Little Hands, and also look at some further guides on some reading that you can do at home as well.
SIDS stands for Sudden Infant Death Syndrome. SIDS is also something known as cot death. It is the sudden, unexpected and unexplained death of an apparently healthy baby. Talking about SIDS can be very scary, but following safer sleeping guidance can hugely prevent the risk of SIDS and can keep babies safe.
So we thought we'd start our session today by looking at a little bit of true or false questions to kind of see where your knowledge is already, and then we can talk through our facts as well. So we're going to start with these two questions. So our first one is, babies should have a mattress, blanket and pillow to make sure they are comfortable and sleeping safely. So do you think that is true or false?
False.
False. Interesting. Right, we're going to move on to our next one then. I'm glad we're in agreement. Our second one is, babies and young children should not be given teddies and blankets while they sleep, as this is a suffocation hazard.
True.
Interesting. So we've got one true vote.
True.
And true vote. Lovely. So let's have a look. So you were bang on. Well done. Our first one was false and the second is true. So babies should have a safe sleep environment, whether it's for a short daytime nap or their longer sleep through the night as well. So that safe sleep environment includes them having a clear bedding that's free from any suffocation hazards. I think a big perception on children is that they need those comforters and teddies and blankets, but actually they can cause a lot of overheating and cover faces, which can provide a bit of a hazard for children. So the safest environment for them is a nice clear space that's free of those hazards. The same for their bedding. They should have a flat mattress, which is covered by a fitted sheet, which is clean and fits appropriately. The risk of if you've got an ill-fitted sheet is that that moves when they're sleeping and then can then act as a barrier to their breathing as well. You did very well on the first one, so we're going to move on to our next true or false.
So our next one is, sorry, babies and children should be placed on their backs to go to sleep.
True.
One true vote.
True from us as well.
So we're in agreement. And the next one is that babies that sleep in a cot should be put in the middle of their cot so that they are not near the edges.
False.
Right, let's see if we're right. So we were correct. Babies and children should be placed on their backs when going to sleep. This is to ensure that their faces and airways are always clear and there is no obstruction. The children can swap sleeping positions and roll over it if they are able to, as long as they can roll themselves back. Babies that sleep in a cot should be placed feet to foot, so their feet should be at the bottom of the cot. That means that if they do wiggle down, they're not going to wiggle over any, if you've got a blanket or anything on them, it's not going to cover their faces.
Well done, everybody. We've got two more to do, and then we'll just recap some facts and move on. So your next questions. For the first 6 months, babies should always sleep in the same room as you, even for shorter naps in the daytime.
True.
One true vote.
True.
Oh, unanimous today. And then the last one, the room that children sleep in should be above 20 degrees, so they are nice and warm while sleeping. What do we think?
False.
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 False. Okay, let's have a look. So again, you were absolutely right. Well done, everyone. So the first one obviously was true and the second is false. So babies should be in the same room as an adult for the first 6 months, at least for all of their sleeps, regardless if it's in the daytime or a nighttime. That doesn't mean that if baby's sleeping in the same room that you can't pop out and get yourself a drink or go to the toilet. You absolutely can, but you just have to make sure that most of the time that they're sleeping, you're there, you're close by and can monitor them, because that's how they're going to be safest. And then room temperature for children, your ideal room temperature is 18 degrees. So this is the kind of temperature that's a bit middle ground. They don't have to be piled on with loads of clothes. They're not going to be cold while they're sleeping, but it's also going to remove the risk of them overheating as well. There are little thermometers that you can buy that kind of help and give you a room guide for how warm your room is, to check with that as well.
So we're now going to go on about co-sleeping. So co-sleeping is a term to describe when babies and children sleep with their parents. So this means like in the same bed, or even if you're on a sofa. So if the child is sleeping with you, that is the co-sleeping term. While it is safer for children to have their own clear sleep space, some parents choose to co-sleep with their children. If you are co-sleeping with your baby, you should consider any risks before every sleep. Keeping pillows and adults bedding away from your baby and any other items that could cover their heads and cause them to overheat. So obviously in a cot, you wouldn't necessarily put any blankets on a child, you'd maintain the temperature. So obviously if they are co-sleeping with yourselves, just make sure the blanket is very much secured down underneath their armpits, so then you've got no way of them wiggling up over to their faces. To reduce the risks of any accidents, not to bring other children or pets into the bed with you. So just making sure that if you are co-sleeping with a young one, just don't have any older children or any pets in the bed, just so then you know that there's no other risk of them going on top to cause any suffocation. Trying to make sure or check that the baby cannot be trapped or wedged or fall off the bed or get trapped between the mattress and the wall. So just making sure that the bedding is clear all the way around and there's no traps for children to get stuck in between any beds. And never leave your baby unattended in an adult bed. Obviously it is much larger and they're not in a contained space, so it could happen where they could bump off the end of the bed. So just making sure that you're always there with them.
Perfect. So I think your knowledge was already really good as we answered the true or false well. So we're just going to recap a few of the facts before moving on to how we keep children safe at Little Hands. So the facts that we've obviously spoke about so far is that soft or raised surfaces such as pillows or quilts can increase the risk of SIDS, which can make it difficult for babies to breathe or cool down. So the best way for babies to sleep is without anything in their cots with them and they're just on a flat mattress. Children should be in a smoke-free environment. There's actually research that shows that children are 50% more likely to have a sudden infant death if they're in a smoking environment. This doesn't just mean smoke within the household. It could be if one of their parents smokes and then they're co-sleeping, because they can be inhaling that secondhand smoke as well. The ideal room temperature for babies and children is 18 degrees. The chance of SIDS is lower when babies and children sleep in the same room as an adult, and obviously that comes from their supervision. You're making sure that you're there to monitor them and keep them safe. Babies should not sleep in car seats unless you are travelling. The safest place for them is on a firm, clear mattress. So that doesn't mean that children can't sleep in their car seats. If you're in the car, if they're in the pushchair, if you're going around and they fall asleep, that's absolutely fine. But it shouldn't be a permanent fixture for them just because their sleeping position, it can have an impact on their neck and they're not on that flat surface. So the advice is if you are travelling and you've been travelling for quite a while, just making sure that you can stop, take regular breaks and get baby or child out to swap that sleeping position for them. And then lastly, babies and children should have a clear sleep space free from pillows, loose blankets and toys. So we know some children like a nice comforter. Obviously, as long as they're monitored, that's fine. It might be that when they're asleep, you want to take it away from them just to reduce that risk. But by no means should their cot or sleeping space be full of blankets or pillows to comfort them.
So here at Little Hands, we have our safer sleep policy. So in our policy, it says that adults are still kept in ratios. So for our babies, which is from birth to 2, it is a 1:3 ratio. For children that are 2 to 3 years of age, it's a 1:4 ratio. And for children 3 years and older, it's a 1:8 ratio. So we maintain these ratios throughout the whole day, and it's especially including safer sleep times. So throughout nap times, we'll make sure that the children are still kept within their ratios. We have thermometers in each room to make sure that the room temperature is ideally around 18. So if it does go above 18, we'll make sure we ventilate the room using windows. So even if the hot summer comes, we won't have fans directly on the children because we don't want to change their body temperature so quickly. But we'll open the windows and we'll have fans circling cooler air around the room. And again, in winter times, we'll pop on the heating, but we won't pop the cots or the beds by the radiators, just to maintain our safer sleep policy. Our cots and mattresses, so we make sure our cots and mattresses are always clean for children when they are presented to them, and they will have a fresh bed sheet put on every sleep time. We do have little sticky labels that we pop underneath the cots too, with the date that we bought them. And we'll just make sure that they are well ventilated and that they're firm, flat mattresses, just in line with our safer sleep policy. We do sleep checks throughout the day. So once the children are all down for their naps, if they are under 12 months, we check them every 5 minutes. And if they're over 12 months, we check them every 10 minutes. We do this just to make sure that their temperature is steady, so they're not getting too hot or they're not a bit chilly. And then we do it as well just to make sure that their breathing patterns are what we would consider normal for that child. So if we do find that, for instance, your child has got a cough during their sleep, a member of staff that are in the room will make a note of that they've had a cough, and we will pass it on to parents during handover, or if we needed to do a courtesy call, we would do this. And it's the same if a child changes positions in their sleep. We will write a note of it, and we'll just make sure parents are aware that they've begun to roll over in their sleep, and is that something that they're doing at home, just so then we can keep those open relationships with parents too. Safer sleep positions. So here at Little Hands, we always place the children to sleep on their backs. So it's just a routine. Even if a child is able to roll over, we will ask the child to lie down on their bed. So if they do gravitate more towards their belly, that is absolutely fine, but it's on our professional judgment. So if we don't think that child is confident enough to turn back over, we will try and encourage them to sleep on their backs, just so we can make sure that they're sleeping in a comfortable position. We do have fitted sheets for all of our beds and mattresses, so it's just to make sure that no sheets can cover any child's face or their mouths to prevent their airways. So again, these are clean sheets every time the child does have a nap. And we do have policies in place which we do follow all the time, and all our staff have read through all of our policies, and we do have regular training updates on any safer sleep policies.
Right, thank you very much. So obviously today has been an introduction to safe sleep. It's kind of a whistle-stop tour, trying to give you the top facts, keep it minimal because it can be quite overwhelming when you're trying to consider a lot of factors, and obviously show you the things that we do at Little Hands as well. We have included a clip here for you to have a look at, which just provides you with some links a little bit more around safer sleep. So we always advise that when you're looking into this, you make sure that it's from a trusted source. There can be a lot of people that make blogs or have different opinion-based information for what works for them and their family. We would say always try and stick to the NHS or a trusted website. So one that we love to use is Lullaby Trust. The links that we've got here are actually really good for providing. They've got different sections on co-sleeping, reducing the risk of SIDS, covering information that we've spoke about today. And they've also got some posters and videos that you can use as well. So with all of that in mind, that comes to the end of our clip today. Have you guys got any questions that you wanted to ask us, or anything that you're not too sure about?
Yeah,
Lauren?
What is your opinion on swaddling and sleeping bags?
So here at Little Hands, we don't necessarily use any swaddles or sleeping bags. However, it is down to the parent's choice. So they are on offer for you to go out and buy. It is something that you can purchase at the shop. All our advice would be is just make sure that they are fitted to that child, so they're age appropriate for that child. So you're not buying extra large sleeping bags where they can wiggle their bodies down in the sleeping bag, so then it won't cover their airways.
We'd also kind of say if you are using a sleeping bag or swaddling them, just making sure you haven't got any additional blankets in there as well, just so they're not overheating. So again, I'd probably say look at the Lullaby Trust website and follow the safer guidance they've got on there. And if you're not sure, maybe have that conversation with your midwife or health visitor as well, because they'll definitely be able to recommend. Any other questions?
Yes, I've got one.
Yeah.
If you have twins, would you recommend that they co-sleep together?
Oh, I'd say that's kind of down to your parent preference and what it is that you want. So quite often with twins, they're born earlier or have like planned C-sections. And then if you're spending time in the hospital, quite often they will put the twins together. And that's mainly for a space saving reason. That said, they make sure that they are following the safer guidance as well. So depends on your preference, depends what you want to use at home, how much space you've got, if you want to buy 2 cots, if you want to buy double everything. It's absolutely fine for twins to sleep together, providing you are still following the same guidance. So making sure that they're at the bottom of the cot, that they're a safe distance apart. I'd say especially for those, actually be really nice as a bonding experience for them. But then when they are starting to roll, that would probably be the time to then separate them, because then the issue you've got, if they're rolling, maybe one does it before the other or vice versa, and then you've got that suffocation hazard coming in. I know, again, Lullaby Trust have got a really good guide on co-sleeping for twins as well, and now they'll be able to offer you more information. I think most of all, it's down to your preference, as long as you can just make sure that they're safe. Have we got any other questions today? Perfect. Well, thank you very much for your time and for joining us for this session. We obviously hold regular workshops, so we'll look forward to seeing you in our next one. Thank you, everybody.